Hello students, welcome back. In this video, we are going to learn about STD, that is sexually transmitted diseases. Sexually transmitted diseases are venereal diseases or reproductive tract infections are called as sexually transmitted infections. So now we are going to learn about how the sexually transmitted diseases are transmitting from person to person. So usually these diseases are transmitted from person to person during intimate sexual contact with infected partners. In the case of hepatitis B and HIV, they are transmitted sexually as well as by sharing the infusion needles, surgical instruments with infected person. And also it is transmitted through blood transfusion and from infected mother to baby. Mainly the people who are all in the age 15 to 24 years are more prone to this infections. So the sexually transmitted infections are divided based on the infectious agent. So according to that, it is divided as bacterial STI, viral STI, then protozoan STI and fungal STI. So now we are going to see about what are all the bacterial STI. So they are lymphogranuloma venereum, then syphilis, chancroid, chlamydiasis and gonorrhea. So what are all the viral sexually transmitted infections are genital herpes, genital warts, hepatitis B and AIDS. So under protozoan STI, we are learning about trichomoniasis. The fungal STI is candidiasis. Okay students, how to treat this sexually transmitted infection. So usually the sexually transmitted infection caused by bacteria, fungi and protozoan can be treated with antibiotics or other medicines. But in the case of viral STI, it cannot be treated. Then how can we overcome this viral STI? Here it cannot be treated, but the symptoms can be controlled by using antiviral medications. Okay, next we are going to see about prevention of STDs. How to prevent STDs? So STDs can be prevented by avoiding sex with unknown partner or multi-partners by using condoms. In case of doubt, better to consult the doctor for diagnosis and get complete treatment. Thus we can prevent STDs. Okay. So next we are going to see about, so already we saw that the STI is classified based on the causative agents. So based on that, now we are going to see about the disease caused by the causative agents and their symptoms and the incubation period. So first we are going to see about bacterial STI. So under bacterial STI, first we are going to learn about gonorrhea. So gonorrhea, it is caused by the bacterium Neisseria gonorrhea, which is the causative agent. So what are the symptoms of this disease is mainly it affects urethra, rectum and throat. And in female, it also affects cervix of the uterus. And it causes pain and there will be pus discharge in genital tract. And also there will be burning sensation during urination. These are the symptoms of gonorrhea. So what about the incubation period? That is 2 to 5 days. So what do you mean by incubation period? That means the time taken by the germs to create the symptoms. That is called as incubation period. The time taken by this bacteria is about 2 to 5 days. So next we are going to see about syphilis. The causative agent for syphilis is Treponema palladium. So this is the bacteria Treponema palladium. So what are the symptoms here? In the case of syphilis, the symptoms are divided into 3 stages. They are primary stage, secondary stage and tertiary stage. So in the first stage, it forms painless ulcer. Ulcer is nothing but wound, which is found on the external genitalia. And in the case of secondary stage, it produces skin lesions, rashes, swollen joints, fever and hair loss. So in the case of tertiary stage, the final stage, so there will be appearance of chronic ulcers on the nose, lower legs and palate, and there will be loss of movement, mental disorder, visual impairment, heart problem and gummas. So gummas are nothing but the soft non-cancerous growth, that is called as gummas. So these are the symptoms for the STD syphilis. Here the incubation period is about 10 to 90 days. So in order to create symptoms in different stages, it takes about 10 to 90 days. So next we are going to see about chlamydiasis. The causative agent for chlamydiasis is Chlamydia trachomatis. The symptoms for Chlamydia trachomatis are trachoma. So what do you mean by trachoma? So trachoma is nothing but the bacterial infection that affects the eyes. And also it affects the cells of columnar epithelium in the urinogenital tract, respiratory tract and conjunctiva. The next bacterial STD is lymphogranuloma venereum. For this disease also, the causative agent is Chlamydia trachomatis. Here the symptoms are cutaneous or mucosal genital damage. Cutaneous means on the skin. Then utritis. Utritis means swelling in the ureter. And endocervicitis, that means swelling near the uterine cervix. So next to uterus is the cervical region. So near to that, the junction of the uterus and the cervix, near to that there will be swelling, that is called as endocervicitis. And also it causes local harmful ulceration and genital elephantiasis. The genital part become enlarged, that is called as genital elephantiasis. So what is the incubation period for these two diseases? Are 2 to 3 weeks or up to 6 weeks. So that's all about the bacterial STD. Next we are going to see about viral STI. So under viral STI, first we are going to see about genital herpes. The causative agent for genital herpes is herpes simplex virus. So this is the herpes simplex virus. The symptoms for herpes simplex are sores in and around the vulva, vagina, urethra in female, or sores on or around the penis in male. So sores are nothing but ulceration or blisters. And also it causes pain during urination and there will be bleeding between periods. It also causes swelling in the groin nodes. The incubation period of this virus is 2 to 21 days, that is average of about 6 days. The second disease, viral STI, is genital warts. The genital warts are caused by human papilloma virus, that is called as HPV. So this is the human papilloma virus. The symptom of this disease are hard outgrowth, that is tumor on the external genitalia, cervix and perianal region. And the incubation period of this virus is 1 to 8 months. Next viral disease we are going to learn is hepatitis B. Positive agent is hepatitis B virus, that is HBV. So this is hepatitis B virus. And the symptoms of this disease are fatigue. So fatigue means extreme tiredness, jaundice, fever, rashes and stomach pain. And there will be liver cirrhosis. So liver cirrhosis means liver damage. So it will cause scars in the liver. Thus the liver become very hard and there will be liver failure. This liver failure occurs at the later stage, the final stage. And the incubation period of this virus is about 30 to 80 days. The next disease we are going to learn is AIDS. So it is caused by human immunodeficiency virus. So this is the human immunodeficiency virus, that is HIV. The symptoms of HIV infection are enlarged lymph nodes, prolonged fever, prolonged diarrhea, weight reduction, night sweat. So these are the symptoms of HIV. The incubation period of this virus is 2 to 6 weeks or even more than 10 years. So that's all about the viral SDI. Next we are going to see about fungal SDI. So under fungal SDI we are going to learn about candidiasis. The causative agent for candidiasis is Candida albicans. So this is Candida albicans. The symptoms are mainly this fungi attacks mouth, throat, intestinal tract and vagina. And it causes vaginal itching, soreness and abnormal vaginal discharge and pain during urination. And there is no incubation period for this fungi. So next we are going to see about protozoan SDI. So under protozoan SDI we are going to learn about trichomoniasis. The causative agent for trichomoniasis is Trichomonas vaginalis. The symptoms for this protozoan infection are vaginitis, that is inflammation in the vaginal region, then greenish yellow vaginal discharge, itching and burning sensation, urethritis, epididymis and prostatitis. So these are the symptoms of this protozoan infection. And the incubation period for this protozoan is 4 to 28 days. So these are the symptoms and the causative agent for different sexually transmitted infections. Next we are going to see about cervical cancer. So how this cervical cancer is caused? Mainly it is caused by sexually transmitted virus that is called as human papilloma virus, that is called as HPV. So how it will cause means it will create the abnormal growth of cervical cells. So because of the infection of this virus that lead to abnormal growth of the cervical cells or cervical dysplasia. What do you mean by dysplasia means? Actually it is the abnormal development of cells within tissues or organs. So within cervix, the cells, the tissues develop abnormally because of the infection of HPV. So what are the symptoms of this cervical cancer? Are pelvic pain, increased vaginal discharge and abnormal vaginal bleeding. So these are the symptoms of cervical cancer. So next we are going to see about risk factors. So what are the factors which cause the cervical cancer? So first one is having multiple sex partners and prolonged use of contraceptive pills. So that also cause cervical cancer. Okay, now how to diagnose this cervical cancer? So what are the methods used to diagnose the cervical cancer? So it can be diagnosed by Papa Nicolau smear, that is called as PAP smear. Along with this, HPV test also taken and X-ray, CT scan, MRI scan and PET scan may also used to determine the stage of cancer. Okay, so these scanning methods, X-ray methods are used to determine the stage of that cervical cancer. Next, how to treat this? So it can be treated by radiation therapy, surgery and chemotherapy. What are the ways to prevent the cervical cancer? So cervical cancer can be prevented by modern screening techniques. So this technique can easily detect the precancerous changes in the cervix. So it will easily say about what are the changes made in the cervix before the cancerous growth. Thus we can prevent that cervical cancer. So as it can detect the precancerous changes, so the women who are all above 30 years are recommended to take the screening test once in a year. So apart from this, cervical cancer can also be prevented by vaccination. So when this vaccine should be administered means it should be administered to the girls who have the age about 9 to 13 years, and that itself should be administered before they become sexually active. So apart from this, we can also prevent the cervical cancer by modifying our lifestyle. So that also help to prevent the cervical cancer. So in what way we can modify our lifestyle? Or by taking healthy diet, by following healthy diet, then avoiding tobacco usage, preventing early marriage and practicing monogamy. So what do you mean by monogamy? Means having sexual relationship with only one partner, that is called as monogamy, and through regular exercise. So these, if you practice all these things in your life, then thus we can minimize the risk of cervical cancer. So okay students, so still now we have learned about sexually transmitted diseases. So under sexually transmitted diseases, you have learned how these diseases are transmitted from one person to another person, and then you have learned that what are the different types of sexually transmitted infections based on the causative agents, how to treat the sexually transmitted infections. Then you learned about the prevention of sexually transmitted diseases, and then you learned about the sexually transmitted diseases, causative agents and symptoms. Then you learned about the cervical cancer and what are the symptoms of cervical cancer, how to treat it, what are the risk factors, and you have learned how to prevent the cervical cancer. So next class we can learn about the infertility and assisted reproductive technology. Thank you.